So today we are going to start another topic in the immunology. In the lymphoid structure, we are going to read about lymphatic drainage associations. So before starting this topic, I want you to know that there is various lymph node cluster in our body, and the lymph node cluster in our body from top to bottom I am going to name here. Those are submandibular lymph node, deep cervical, supraclavicular, mediastinal, hilar, axillary, epitrochlear, periumbilical lymph node, celiac, superior mesenteric, inferior mesenteric, para-aortic, external iliac, internal iliac, superficial inguinal, and popliteal. So these are the lymph node cluster that are found in our body, and I want to emphasize on that is the dotted area of the lymph node which you see in this picture are the palpable lymph node, while the encircled lymph node are the non-palpable lymph node in our body. So these are the lymph node cluster. So also I want you to know that the right lymphatic ducts drain right side of the body above the diaphragm into the junction of the right subclavian and the internal jugular vein, whereas the thoracic duct drains below the diaphragm and the left thorax and the upper limb into the junction of the left subclavian and the internal jugular veins. So one the clinical note you have to know is that the rupture of the thoracic duct can also cause chylothorax. Now we are going to talk detail about the individual lymph node cluster and the area of the body drained by that lymph node and the associated pathology with that lymph node. So first of all, we are going to talk about our first lymph node, that is submandibular lymph node. The submandibular lymph node drains the oral cavity of our body, and any associated pathology regarding the submandibular lymph node is associated with the malignancy of the oral cavity. Another is deep cervical lymph node. The area of the body drained by the deep cervical lymph node is head, neck, and oropharynx. The upper respiratory tract infection, infectious mononucleosis, Kawasaki disease, malignancy of the head, neck, and oropharynx are the associated pathology with the deep cervical lymph node. Supraclavicular lymph node drains the abdomen and the pelvis. You have to know that supraclavicular lymph node is also known as Virchow lymph node. So the any associated pathology with the supraclavicular lymph node denotes the malignancy of the abdomen and pelvis. The mediastinal lymph nodes drain the trachea and the esophagus, and the hilar lymph node drains the lung. So any pathology associated with the mediastinal and hilar lymph node denotes the pulmonary TB, which may incorporate the unilateral hilar, or sarcoidosis, which incorporate the bilateral hilar, or lung cancer or granulomatous disease. So these are the 4 diseases which can involve the mediastinal and hilar lymph node. The axillary lymph node drains the upper limb, breast, skin above the umbilicus, and the associated pathology with the axillary lymph node is mastitis and metastasis, especially the breast cancer metastasis. The epitrochlear lymph node drain the hand and forearm. So the epitrochlear lymph node is associated with the secondary syphilis. The periumbilical lymph node is associated with the gastric cancer, and the periumbilical lymph node drains the abdomen and pelvis. So you have to know that there are 2 lymph nodes which drain the abdomen and pelvis. One is supraclavicular lymph node, and another is periumbilical lymph node. The periumbilical lymph node is also known as Sister Mary Joseph node. So we have another lymph nodes. You have to know the 3 lymph nodes consecutively, that is celiac, superior mesenteric, and inferior mesenteric, because all these celiac, superior mesenteric, and inferior mesenteric associated with the mesenteric lymphadenitis, inflammatory bowel disease, and celiac disease. The celiac lymph nodes drain the liver, stomach, spleen, pancreas, and upper duodenum. The superior mesenteric lymph node drains the lower duodenum, jejunum, ileum, colon to the splenic flexure. The inferior mesenteric lymph node drains the colon from the splenic flexure to the upper rectum. So the celiac, superior mesenteric and inferior mesenteric lymph node are associated with the mesenteric lymphadenitis, inflammatory bowel disease and celiac disease. The para-aortic lymph node drains the pair of testes, ovaries, kidneys and the fallopian tubes. So the para-aortic lymph node is mainly involved in the various metastatic lesions. So another group of lymph node that you should know in consecutive way are external iliac, internal iliac and superficial inguinal. So all external iliac, internal iliac and superficial inguinal lymph node are associated with the sexually transmitted infection, medial foot or leg cellulitis or superficial inguinal lymph node is also associated with the leg cellulitis. So the external iliac lymph node drains the cervix, superior portion of the bladder and the body of the uterus. The internal iliac drains the lower rectum to the anal canal, above the pectinate line, the bladder, the vagina, middle third of the vagina, the cervix and the prostate. The superficial inguinal drains the anal canal below the pectinate line, the skin below the umbilicus except the popliteal area, the scrotum and the vulva. So all these three lymph node, group of the lymph node, external iliac, internal iliac and superficial inguinal is associated with the sexually transmitted infection and the medial foot or leg cellulitis. The popliteal lymph node drains the dorsolateral foot or the posterior calf, and it is associated with the lateral foot or leg cellulitis. So you have to know that the lateral foot leg cellulitis is associated with the popliteal, whereas the medial is associated with the external, internal and superficial inguinal lymph node. So we have discussed the various lymph node clusters, the area of the body drained by those lymph node clusters and the associated pathology involved with those lymph node clusters. So I hope you understood this topic on the lymph node drainage associations. So this concludes our topic. Thank you.